Congress is scheduled to vote today, possibly tomorrow or Monday, depending on what their schedule is dictated in terms of their vote totals. But they're scheduled to vote on a health care bill today. That was just announced and released to the public earlier this week. And we had an opportunity to print out that bill, and if any of you have a chance, this is the new bill that we're talking about. It was, when I printed it yesterday, 1,990 pages. Today it actually expanded by another 40 pages due to the amendment process. So we don't even have the complete text of the bill that they're now looking at today. You know, the Republicans in Washington came up with their own alternative, which is this. So this is the bill that we were talking about over the summer. This is a 1,000-page bill. And then this bill is what we're talking about now. And this is supposed to be the better bill. This is almost double size of the bill that they had filed back in August. And again, this was released to the public earlier this week. I can't imagine that anyone has had an opportunity to read it. I've started to read it. I'll continue to read it, but I haven't been able to complete it yet because it's only been available for a few days. And it's virtually impossible to read 2,000 pages in the short amount of time that it has been released. I'd also like to remind you that regardless of what your position is on health care, we have a Congress who wants to vote on this bill. And I don't believe that members of Congress have had a chance to read it either. But we're voting on this bill because the President has said it's in our best interest to change the health care system as we know it today for every American and for every person who lives in our country. Now, we've had this debate for the last 6 months or so. And I suspect that there are many people in our country who probably want some sort of reform. I believe that there are many reforms that are necessary to improve the delivery of the system to those who have health insurance and health care. And there are some necessary improvements and changes for those individuals who can't truly access and afford health care in our country. But the direction that this legislation takes us to a government-run health care industry, I think is detrimental to health care itself, is detrimental to the relationship between the doctor and the patient, and it takes the ability for you as a patient to make direct decisions about the future of your care and quality of care. And the one consistent thing that I hear from physicians is that they want to make sure that the decisions that are made with their patients are between them and their patients, not between them, their patients, and a government entity. And as we look through that piece of legislation, which was supposed to improve upon the first bill that was proposed, there are still government-run and government-forced care. There is still an individual who's going to determine and dictate what kind of care you can receive. There is still an individual who will determine waiting lists and who is on them and how long you'd stay on. And I don't believe that that's in the best interest of our healthcare industry. Nor do I believe it's in the best interest of you as a patient should you need direct and immediate care for a certain type of ailment that you may have or you may have in the future. Since August, I've talked to many, many people across our district who have stated that they are concerned and they want reform. But I will tell you the one consistent, clear message that I hear is that the majority of people in New Hampshire do not want a government-run health care bill to pass this Congress. And I decided to hold this forum today because our members representing the state and Congress representing this country are going to vote on that bill today. And we need to be fully aware of the implications should that vote pass. And we need to band together and ensure that the delivery system is as efficient and effective as possible for every person who's looking for a quality health care option. Now, as I've talked about in the past, there are, in my view, two areas of concern. Those of us who have access to health care who want to reduce the cost, and those of us who can't afford or can't access care, and how do we address that particular issue? So for the 84 to 85% of us who have health insurance, who have health care that we are happy with, how do we reduce that cost? And I think in New Hampshire specifically, there are several ways we can do that. First of all, as many of you know, health care is driven largely by your employer. You go to your employer, you sign up for health insurance. Each and every year, you probably have a copay that changes, probably goes up, as well as your employer's cost goes up each and every year. That's a problem. It's becoming an extremely large line item for every business, small or large. And as we all know, New Hampshire is comprised of largely small businesses. More than 90% of our economy is driven by small business. So if you're a small business owner and you want to try to reduce the cost for your small business and for your employees, the first thing that I think we need to be focusing on in terms of legislation is allowing small businesses to pool their resources and negotiate rates with health insurance companies. That would give small business, which is the predominant generator of our economy in New Hampshire, the same level of access and cost reductions as big businesses do. I've heard it from each and every small business owner that I've met. And a small business, in terms of insurance costs, is 100 employees or less. So if you have less than 100 employees, you can negotiate. If you get over that threshold, you can negotiate, and your costs will come down anywhere from 10 to 20%. And most small businesses I know want to pass that cost on to their employees and keep employees employed and make sure that you also receive the same benefits that they do. But secondly, we as consumers need to be driving our own care. We need to have greater personal responsibility. We need to have greater understanding and command of the cost of our health care. And the only way to do that is to put ourselves in the driver's seat. And I believe that we should be able to buy it directly. And the reason we don't right now is because it's too costly. It's far too costly. Businesses and companies get tax credits and tax deductions that employees don't have right now under the law, that single-payer customers don't have under the law. And if you could be provided as a customer, as a single individual, the same direct financial benefit that your employer receives, you would then be more likely to start purchasing your own and start saving your dollars through the different HSA programs that already exist that need to be expanded, so you can start directing your care. But the reason we don't direct our care is because we don't know the cost. Like if you go to the grocery store, you know what a gallon of milk is going to be, you know what a dozen eggs are going to cost, you know what a loaf of bread is going to cost. We don't know, as consumers, what our health care costs. And we should be able to know that so we can reduce the cost of our care and to ensure that the care we do receive is the appropriate level of care. Now, when we look at this piece of legislation, I have a very difficult time believing that this is in our best interest.